Welcome to Doctoring You, a place for better health through higher understanding. This Doctoring You presentation will share insights on the life challenges into senior years. Join Dr. Michael Siu and guest Betty Hui in part 3 of an informative discussion related to dealing with life challenges as we move into our senior years and staying healthy. And now, Dr. Michael Siu.
So, for the final part of this recording, I think what I like to do is to help people who are at your stage of life.
Mm-hmm.
Your kids are grown, your grandchildren are well taken care of.
Mm-hmm.
You don't have any responsibility anymore except yourself.
Yeah.
Now,
Yeah.
I think there's a level of concern.
Mm-hmm.
Okay, most people, when you're healthy, you have no concern. You just live day by day and hope that everything goes well. But we know not everybody is going to be as fortunate. They will get sick.
Yeah.
How do you get through the daily activities, and how do you prepare yourself one day? So, well, if I should get sick, what happens? Do you think about it?
I didn't really think about that much. I have too much to do.
Okay, all right, good. Now, in many ways, I think for the audience, I think it's a good way of looking at life is that if your life is full, you don't have time to think about bad things,
No, I
right?
don't think about it.
And especially in good health, why worry about bad health, right?
Right.
Now, there's two ways of looking at it. As a doctor, I would say, okay, so that means you have committed to taking care of your own health
Yes.
and make sure you don't get sick.
Right.
That's number one.
Right.
So, and there are many ways of doing preventive health care. So this is where I come in. I preach to you and all the others. Say, how do you become the best in your health? You know, so so number two, of course, is that how you feel about your health is very different from what a doctor says. You know,
I feel like my health is pretty good.
Good. Now you look fine, okay, and I know you're fine. So, for people out there who don't know because they're not medically oriented,
Right.
they don't know, and you know because you know you have gone through all these illnesses that you know about. You know how to. What are the warning signs, and how what do you do? I mean, I would advise my patients that, well, okay, you go out there, you have periodic checkup. And if you have problems, take care of it early than late. Now, in your life so far, that to achieve the good quality of life that you have enjoyed, would you echo me on that, or would you say, you know, those who don't see doctors, what do you advise them to do?
Well, I think they should use their own judgment. Now, I like to give, for example, if you have problem in defecation, all right, then you know that you ought to eat more vegetable, more fruit, right? So you don't have to worry about this.
Right.
And for other...
What about social activities? What about
That's good
exercise?
too. Yeah.
What do you do?
I do work out.
You do work out? Okay.
I do work out. But during the daytime, I'm so busy with the kids. With the daycare kid, I don't have any time to rest. So on the weekend, Saturday, Sunday, I go to work out.
Okay, very good. So not only taking care of kids in a daycare that you volunteer,
Yeah.
you also work out on the weekend.
Yeah.
So every day is occupied. You have something to do
Right.
physically.
Right. At the nighttime, I have work to do too.
Okay.
And I have so many things I want to
Okay.
learn.
Well, I'm very impressed. Betty, thank you very much for coming to share this with us because I think we all have different levels of understanding in health, and your experience will definitely enlighten a lot of us. It certainly has, you know, helped me to understand the difficulties that we have in life. A lot of times is persistence. Yeah, like you just persistent and you overcome it.
Right.
Thank you so much.
You're welcome.